Hey, you may already be thinking about how you're going to eat better, you're going to get fit, you're going to swear off bad vices like smoking. Your resolve is strong. So why do the vast majority of people turn back to old habits within a few weeks after making those New Year's resolutions? Well, there's a new medical specialty called lifestyle medicine, and Dr. Leanne Morello from Spectrum Health joins us this morning to tell us why this happens so often and how your team may be able to help. Good morning, doctor.
Good morning.
Thank you for being here. So why do we do it? Why do we fail? Everyone makes those New Year's resolutions. Some people, like myself, resolve to not make any resolutions because they know they're going to break them anyway.
Right.
Why does it happen?
Yeah. Despite the best of intentions, the vast majority of us don't stick to our goals or meet those resolutions. And I think it's because we don't often approach New Year's resolutions like we would if we were doing a change any other time of the year.
Okay.
We really need to appreciate that change is a process, it's a journey. It does require some effort and some preparation, and it doesn't just magically happen overnight because now it's a new calendar year.
Absolutely. I think we were talking before we went on the air how I got a gym membership a couple months ago. I thought I'd beat the rush and try and do this. And I keep telling myself when I'm at the gym, this is a long road. It's a marathon, right?
Yes.
You're not going to see those instant results. Don't get discouraged within the first couple of months. It gets hard, or you hit a wall, things like that, right?
Absolutely.
But one of the key things I think from this lifestyle medicine that I'm seeing is having someone to do it with.
Absolutely. Having support is tremendous. It makes change so much easier, more successful, and even more fun. And really important to have those cheerleaders and also folks to hold you accountable. So really looking out for you and making sure you're sticking with your resolutions. And even now beyond family, friends, coworkers, there's so many different health apps that offer digital and virtual coaching. So you can even get support in new and different ways.
Yeah, I'm looking at these mirror commercials for that new mirror company, but I'm thinking a real person. You said hold you accountable.
Yes.
I mean, and to make it fun to do something. We're looking right now at a creative, or creating a healthy lifestyle, and that first one you say is pretty simple and pretty important. Take it slow.
Yes, absolutely. While for a few people, that kind of cold turkey or doing a whole overhaul of your lifestyle can work, for the vast majority of us, change is most successful if it's incremental. So really important to have those small steps towards a bigger goal.
Now, this also applies to not just, we were talking a lot about exercise and taking it slow and having a buddy, but when it comes time to losing those vices, taking it slow and having a partner and someone to walk alongside you with that is just as important.
Absolutely. And again, for some people, if we want to use smoking as an example, for some people it does work to just quit cold turkey, but many times it's gradual change, cutting back, finding those substitutes. What are you going to do rather than smoking?
Right.
You know, eating carrots, chewing on gum, those kinds of things. So really taking it gradually tends to help people in the long haul stick with it.
Talk about this new specialty, this lifestyle medicine. I mean, this it is newer of a specialty.
Yes.
What does lifestyle medicine mean?
Yeah, so healthcare is realizing that there's a bigger role that doctors and healthcare clinicians can and should play in helping people to get and stay healthy. And so with lifestyle medicine, it brings together a multidisciplinary team, so health coaches, dietitians, physicians that have all been trained and even board certified in lifestyle medicine. That's a new certification in the last 2 years.
Neat.
So then that healthcare team is really specialty trained to help people, empower them to make their own change and really help them design a personalized plan for them.
And a lot of this is preventative, right?
Yes.
This is getting to the problem before it's a problem.
Absolutely, but with lifestyle medicine, we can help individuals both prevent, manage, and even sometimes reverse chronic disease. So much of chronic disease is attributed to our poor lifestyles and health behaviors. I know we don't want to hear that, but and so with lifestyle medicine, the physicians and providers can really help people gear their changes to those that will work best for them, whether they're at risk or already have chronic disease.
Well, we may not like to hear it, but sometimes you need that firm voice, you know, to say, hey, listen, you really need to do this. And I love that last one on creating a healthy lifestyle. Don't expect perfection. Realize that there's going to be setbacks, but to stick with it.
Absolutely. Be forgiving. Change is a process. There are going to be slips. What we find is that it's so much easier to get back on track, especially if you don't get too discouraged. Just reflect back on how successful you've been, get back on track, and it'll be so much easier than starting from scratch.
Well, thank you for all of the information. And it's fascinating to learn about this new lifestyle medicine discipline where you can go to Spectrum Health right now and learn more about it. It says culinary medicine, but I'm gonna assume it's lifestyle medicine.
No, it is actually culinary medicine.
Is it really under the culinary medicine?
It is right now.
Like food is medicine as well.
Exactly. So that is programming that we have up and available right now, and lifestyle medicine will be coming in 2020.
Well, eating is part of lifestyle.
It is. Very important
It's all
piece.
connected. Thank you, doctor, for the